Hi, I'm Dr. Jackson. I'm going to lead you through the veneer process. Veneers are a cosmetic makeover of the teeth. People that should consider veneers are people that aren't happy with their teeth, the way that they look, or their shape, or their color, or anything that they'd like to change with the veneer procedure. The point of the initial consultation is to have a conversation about your teeth and see if we can get you from where you are right now to where you want to be.
I kind of have a gummy smile, but
Do you have a lingual bonded retainer?
I don't.
We look at all sorts of factors, including the existing color and shape of your teeth, what kind of work has been done in the past on your teeth. We look to see if veneers are even possible. We look to see if we can provide you with the results that you would like. Shelly came in and we took an impression of her teeth the way that they are right now. She wanted her lateral incisors, these two teeth, to be a little bit longer, a little bit straighter. She wanted to get rid of some discoloration on her front teeth and make them really symmetrical. She's had a little bit of wear on her teeth, and she's really particular about her teeth. And so to avoid any guesswork in how the teeth are going to turn out, we sent this model to the lab, and they did what we call a wax up. Made them out of wax to see what they would look like. It's called a diagnostic wax up. So this is one of the steps that we utilize to eliminate any of the guesswork and the fear of wondering, how are my teeth going to come out, or how are they going to look? So Shelly is going to come in and she's going to look at these teeth. I'm going to show them to her, and if she approves of the way that they look, then great, and if she doesn't, then we can make the changes that she wants and get it just the way that she likes it. Once we get it to the point where she likes it, she still won't know what it looks like in her mouth. And so we'll do what we call a trial smile. And what we do for that is after we've got the teeth where Shelly wants them, we take an impression of the teeth of this wax up right here using this material, and it forms a stent to do the trial smile. So we'll take this this stent right here that shows the wax up. This will create like a temporary veneer for her so that she can see what it looks like in her actual mouth. So there's no guesswork there either. Make sure that that's really what she wants before we do the veneer process. It only lasts a day, but it gives her the chance to really look at them, make sure that that's what she likes. The nice thing about doing a trial smile is that you get to see exactly what you're going to get before we do the real work.
Getting numb. That's right. Yay!
To make a patient comfortable, we'll place topical anesthetic benzocaine it's kind of like baby Orajel, to make the patient more comfortable when we do any injections. The veneer procedure can be a little bit sensitive without being numb, so we try to get the patient numb, make them really comfortable. After we get you numb, we will take a few minutes to get a shade of your teeth. We use special shade guides to make sure that you get the color of teeth that you like, and we take pictures of the shade guide and the way that your teeth look right now, and we send those to the lab so that they can make sure to use the right porcelain. We have the reduction stent, and I place that on and off the teeth to make sure that we have enough room for the lab technician to put their porcelain. So I put it on the teeth, I measure with a probe on every single tooth to make sure that we have the amount of room that we need, so that if there are any changes that need to be made or any more reduction that needs to be made, we can make it there while you're already numb the first time instead of having to have you come back. The gingival retraction cord has some special medicines in it that help shrink your gums temporarily to get them out of the way so we can take an accurate impression. After we place the gingival retraction cord, often we'll prepare just a little bit more on the teeth and move the preparation up a little bit so that the ends of the veneers are underneath the gums where you can't see them. After the gingival retraction cord has been placed and the final preparations for the veneers have been completed, we use a blue impression material to capture all the fine details of the final preparation.
Round two. Sorry to stretch you out so far there.
I've had some really wise dental professors in the past tell me that the most important step in dentistry is the step that you're on. So just like every other step during the veneer process, the impression has to turn out perfect for the lab so that they can make really nice veneers. So now what we're going to do is we're going to take this stent right here. So
Now that we've got the wax up where we want it, or mostly where we want it, we took an impression of the wax up. It slides right on there like that. And we're going to put this on your teeth with some temporary material so that you can see exactly what this will look like in your mouth. After the acrylic is set up for about 1.5 minutes, we carefully remove it. And you have to be really careful and delicate at this point. As you can see, all the veneers are connected together. And we place those over the teeth to make sure that everything looks great, and then we can polish it. You should know that the temporary veneers are all one piece, and we do that on purpose for strength, but the permanent veneers will all be individual like your natural teeth. After the final impression, we'll take what's called a bite registration to record how your lower and upper teeth come together. Let's etch this.
It's time to cement them. We'll use a special resin adhesive to cement those to the teeth.
We're etching the tooth in just one little spot in the middle, because this increases the bond strength by quite a bit. So this will kind of tack the temporary down to the tooth.
We'll load the veneers and we'll place them on the teeth, and then we'll use a special curing light to harden the cement.
So now we have these temporaries made exactly, really close to what the permanent ones will look like. Hey, open a little bit bigger, Shelley.
After we cemented the temporary veneers, Shelley told me that she wanted a couple things changed with the temporary veneers so that she could look great for the next couple weeks, and we just made the changes right there in the office.
If anything, I think it looks bulkier. I see what you're saying. I think most people are going to look at that and not know you have anything done.
Yeah, I agree.
No,
Oh my
no,
goodness.
like your smile looks totally normal.
So numb.
Great, yeah.
This is the last stage of the veneer process, and also the most exciting. We're going to cement Shelley's permanent veneers. Here we are preparing the temporary veneers to be removed by placing a small slot in the middle of each one. Then we use a special instrument to separate the veneers from the teeth and clean them off. To clean the teeth the rest of the way, we use a fine pumice, which is kind of a sandy material to remove any excess cement from the teeth.
Smile? I don't believe that, but
We take a quick minute to floss before we cement the veneers to make sure there is nothing left in between the teeth. Here I'm using a micro brush to clean the teeth one more time. Here we are trying each veneer on one by one to make sure that the porcelain matches the tooth really well and that the color looks right.
So the regular cement that we're going to use, like when you actually bond the tooth to the bond the veneer to the tooth, it changes colors a little bit, usually a little bit darker. So this lets you know how much darker it's going to be, but it actually doesn't look. Yeah, so I think we're good. So there are different shades of cement that you can use if you wanted to lighten one up or darken one. You can use different shades. So we're going to bond the veneers and we're going to etch the veneers and rough the porcelain up, and then we're going to etch these teeth, and then we're going to put them together. So at this point, we're ready to prepare the porcelain veneers to be cemented to the teeth, and we do that by using a special etchant on the veneers and then rinsing it off. So we're etching and preparing the enamel on the tooth to bond really well. This is the first stage of bonding for the teeth themselves. So we're going to put this layer of bond on, and then we're going to fill our veneers with cement and place them one by one. The nice thing about this cement is it doesn't harden up until we light cure it. Let's go with let's go back to floss.
If they bug me at all, I can have you adjust the spot, but
You don't look like you have like big huge chiclets.
yeah, and I'm not like concerned about anything. I just feel like they look just boom, just good, yeah? I just like they look good. Oh, they look so good. You know, I cannot tell.
You're doing the best you can.